My name is Mark Heyrman. I'm a clinical professor of law at the University of Chicago Law School. Today I'm going to be talking about recent changes to Illinois laws that affect people with mental illnesses. One of the most recent laws that was enacted that affects people with mental illnesses is Public Law 990761. This is a law that limits the ability of health insurance companies to impose so-called step therapy on people who have health insurance in Illinois. Step therapy is designed to reduce costs in the health insurance business, which is of course a goal we all share, but it does so by requiring everyone to start on the cheapest possible medication for whatever condition they may have, including serious mental illnesses. So you must first try that cheapest medication, and if and only if you fail are you allowed to have another medication. And then if you fail at that, you can have yet still a more expensive medication. That's why it's called step therapy. You go through 3 steps. It's also called fail first because you must fail at each medication before you're allowed to get a different medication. This, of course, does save money, and that's important. But there are reasons why some people should not be required to engage in this process. And that's because failure can often be devastating for people with serious mental illnesses. A failure may result in loss of employment, disruption to family life, hospitalization, and sometimes even involvement in the criminal justice system. So this law is designed to require health insurance companies to allow patients and their doctors to have exceptions to step therapy where the medication is either been already tried by the patient and failed with another insurance company, or has been shown to have excessive side effects that harm the patient. Despite a lot of differences between the parties in Springfield, there has been a consensus under the leadership of Governor Rauner that we should try to get people out of the criminal justice system. He committed himself when he took office to reducing the prison population by 25% by the year 2025. This is very important for people with mental illnesses because there are at least 8,000 people with serious mental illnesses in the Illinois Department of Correction prisons, and at least 3,000 in local jails and lockups. So there are 4 bills that were passed, all of them modest, but they will have some positive effect on reducing the number of people with mental illnesses in prisons and jails and in the criminal justice system. The first one mandates veterans courts. Veterans courts are one of these newfangled courts that are criminal courts that are designed to divert people from the criminal justice system, in this case, veterans. And of course, as we know, many veterans come back from service with serious mental illness and substance abuse problems. This allows them to be diverted to probation or supervision. And this new law requires that every circuit court now must have a veterans court. A second change to criminal law that affects people with serious mental illnesses is there is now a provision in the sentencing laws that a judge must take into account mental illness in thinking about whether it mitigates the harshness of the sentence to be imposed. Of course, if mental illness is not present, the judge does not have to take it into account. The judge still has complete discretion. But this law requires, if there is mental illness, that the judge may take it into account, and that may result in a lower sentence or a sentence of probation rather than imprisonment. A third law is really about juveniles in the juvenile justice system with mental illness. It creates a task force that is designed to identify community mental health services that may be available for young people who are in the juvenile court system to keep them out of juvenile detention and divert them to community treatment programs. The fourth law is a general law that requires judges to consider whether probation may be appropriate for low-level felons. That is, people who've been convicted of a Class 3 or Class 4 felony. Those are the 2 least serious criminal sanctions. And it requires the judge to give a reason if a first-time nonviolent offender is to be sentenced to imprisonment rather than probation. Another amendment to the Mental Health Code this year changes procedures for involuntary treatment hearings. For some time, it has been lawful in Illinois to use video conferencing facilities for involuntary commitment hearings, that is, for hearings in which someone will be committed to a psychiatric hospital. Using video conferencing facilities allows witnesses and others to be at one location, the judge to be at another location, and maybe the patient to remain in the hospital so that he or she does not have to be transported. This law has been amended so it also now covers the involuntary hearings in which people can be ordered, following a court hearing, to have involuntary medication or electroconvulsive therapy. Though both the old law and the new law cannot be implemented unless either the Supreme Court passes rules to do so or one of the circuit courts does. The Circuit Court of Cook County has just passed rules to do this. Other counties, other circuits may wish to consider this. I think this may be particularly beneficial in rural counties where hospitals may be some distance from the circuit court. Over the last number of years, in order to save money and to improve the coordination and quality of care, our Medicaid program has moved from fee-for-service to managed care. More and more people who are receiving Medicaid benefits are now in a Medicaid managed care program. This is particularly important for people with mental illnesses, since in Illinois, like all of the other 49 states, Medicaid is the largest funder of mental health services in Illinois. These Medicaid managed care programs, like many programs, allow the patient to choose between several different Medicaid managed care companies once a year. Unfortunately, the information available to patients in making that choice has not always been up to date and comprehensive and accurate. So two new laws are designed to create greater transparency and require that Medicaid managed care post on the internet and make available in many other ways information to people about what providers there are in the network, exactly what services there are available in that Medicaid managed care network, and how you access those services. This will help patients make choices and give them better access to care. For more information on what's new in mental health law, please view my full presentation recorded during the What's New in Mental Health Law program and available in the ISBA online archive.